Hello, my name is Lahome. I'm a Wallen University student, and this is my ID. Okay, and I'm going to be doing a head to assessment on Miss and my patient. Okay, I'm going to scan the room. Okay. All right. So, hi, my name is Lahome. I'm a Wallen University student, and I'm going to be doing a head to assessment on you. Can you tell me your name and date of birth?
I am Michael Johnson, born on September 22nd, 1975.
All right. Thank you so much, Mr. Johnson. All right. So I'm going to go wash my hands, and I'll be right back. All right, Mr. Johnson. So I'm going to be doing a head to assessment again. Like I said, is there any abnormalities or anything that you're concerned with?
No.
Okay. So what I'm going to be doing, I'm going to just be doing some touching and palpating, and I'm going to be checking your reflexes and some other stuff, and I'll explain to you as I go. Okay. All right. And also I'm going to be checking your eyes. All right. So now I'm going to start with Mr. Johnson's head. I'm going to assess his head. Let me see your scalp. Thank you. All right, start nice and clean. I don't see any abnormality there. Anything noted? No hematomas, nothing, no abnormal disfiguration with the scalp itself. And so now, Ms. Johnson, I'm going to look at your head. Can you look forward? All right, so his head looks symmetric. His eyes symmetric. Nose is symmetric with his face. And his ears are symmetric. All right, and so far his body, his chest looks symmetric. Okay, just looking at Mr. Johnson. So, Ms. Johnson, let me just overall look at your skin. All right, everything looks okay there. And I'll assess more as I go down, all right? Let me look at your fingernails, no clubbing. Noted. I'm just going to measure really quick the fingernails. Okay. All right, everything looks okay there. Thank you. All right, Ms. Johnson, so let's start with your eyes. I'm going to look into your eyes. All right, so I'm going to use the ophthalmoscope, and I'm going to just check your eyes. All right. Very good. Don't see anything abnormalities, any veins or anything that's poking out. No redness on the left eye. Same thing with the right eye. Everything looks okay there. All right. So let me check your conjunctiva. Conjunctiva nice and pink. Sclera is nice and pink. So now I'm going to check his cranial nerve 3, 4, and 5, which is the oculomotor, the cochlear, and the abducent. All right. So Ms. Johnson, let me check your. Just look forward. Look straight ahead at me. Let me check. All right. So left eye is a 3 mm. Pupils equal reactive around to light. Can you just look forward for me? Thank you. All right, same thing. Right eye 3 mm, pupil equal to round and reactive to light. Thank you. All right, so now, Ms. Johnson, I want you to follow my fingers. All right, so I'm going to go to your nose. I'm going to be going down to just follow my finger. Very good. All right, so I'm going to make an X. Just continue to follow my finger. All right. So now I'm going to check your optic nerve, okay? Cranial nerve 2. So can you cover your right eye for me? Thank you. And now tell me how many fingers I have up.
2.
Thank you. Thank you. All right, can you cover your left eye? Just look straight ahead.
2. 2.
Thank you, sir. All right. Do you have any questions?
No.
All right. Okay, Mr. Johnson, now I'm going to go ahead and I'm going to check your smell. Let's get olfactory, which is cranial nerve 1. So I'm going to put something there, and you're going to tell me what you smell, okay? What do you smell?
Vanilla.
Thank you. All right, so let me just go ahead and look into your nose just quick since we did the nose part here. Just make sure everything's good there. All right, so left nose looks good. No redness notice, no drainage. All right, everything looks good on the right nose also. So now I'm going to check your ears. All right, so I'm gonna go ahead and check his ears, which is the I'm gonna go ahead and look into Mr. Johnson's ears, and I'm also gonna check for his cranial nerve, Augustin cranial 8. Can you tell me what you hear? Do you hear anything?
Yes, on the left hand.
Okay, on this side.
That's your right.
All right, so very good. So let me go ahead and look in and then out to your ears. All right, time membrane is good on the left ear. No bulging noted, is intact, no redness or drainage. Let me go ahead and look in the right ear. Same thing. No bulging redness or any drainage noted, and no build of wax. So everything looks nice and clear in there. So now I'm going to use the turning fork, Mr. Johnson. I'm going to tell you, I'm going to ask you, what do you hear? And you just going to tell me what you hear, okay?
The vibration.
Okay,
The vibration.
thank you.
The vibration.
All right. On this side,
And vibration.
thank you. Back here,
And vibration. And vibration.
thank you, sir. All right, Mr. Before we go down, let's go ahead and do the snaling chart. I'm going to check Mr. Johnson's eyes. Do you wear glasses or contacts?
Contacts.
Do you have the contacts in now?
Yes.
Okay, that's fine. All right, so tell me what you see on this line here. What do you see?
LTFPH.
Very good. Can you put your hand over your right eye? And then tell me what you see on this line here.
LTFPH.
Very good. And then the other eye, right hand. Thank you.
LTFPH.
All right, so Mr. Johnson tests good 20/20 actually with his contacts on the bottom line, which is line 20/20. Thank you. All right, do you have any headaches, any problem with your vision? Everything's okay. How often do you see the doctor for your peripheral, for your vision?
Once a year.
Very good. So when was your last appointment?
Last year.
Okay. All right, so you're in the year for your eyes. Okay, thank you so much. All right, so now I'm going to check Mr. Johnson's cranial nerve 9 and 10 as the glossopharyngeal and the vagus nerve. As I also look into his mouth, I'm going to put all that together and just check everything. Open your mouth for me. Say ah.
Ah.
Very good. That was vagus nerve 10. All right, and everything looks good. Dentines looks good inside of Mr. Johnson's mouth. Everything looks okay. Throat is nice and clean. Pink and moist. Tongue, mouth is moist. Thank you so much. So now, Mr. Johnson, I'm gonna check your glossopharyngeal cranial nerve now, which is I want to give you some water, and I'm gonna tell you when to swallow, and I'm also gonna check his tracheal line when he swallows. All right, go ahead and swallow for me. Very good. Swallowing looks okay. There's no coughing or deviation from when he swallows. Tracheal line is nice and intact and in line. All right. So now Mr. Johnson's chest is symmetric. Shoulders symmetric. So I'm going to check cranial nerve 11 and 12. Which 11 first is the spinal. Now we're going to check Mr. Johnson's strength. Okay, I'm going to push down and you're going to push your shoulders up against my hands. Again. Very good. So now number 11 also includes the stigmomystoid muscle. So I want you to take your chin and put it against my hand, one at a time.
Okay.
Very good. Very good. Thank you. Now, cranial nerve 12 is hypoglossal. I'm going to have you long your tongue out for me. Very good. Open up your mouth a little wider. Thank you so much, Mr. Johnson. All right. So now, Mr. Johnson, I'm going to go ahead and I'm going to check assess your, let's go ahead and check your weight. Before Mr. Johnson got started, I checked his weight. He was 186 pounds. And I checked his vital signs. I checked his heart rate and rhythm. He was afebrile. He had a temperature was 98.2. Okay, so all that was done prior. So now I'm going to listen to your lungs. Breathe in and out for me. All right. Anterior lungs is clear. To auscultate. Let me listen to this one. Breathe in and out for me. Posterior. Take a deeper breath for me. Thank you. Very good. All right, so Mr. Johnson's lungs are nice and clear. I didn't hear any wheezing, no stridor, nothing. Everything's clear. And he don't seem to have any coughing at this time. Okay, Mr. Johnson, so I'm going to have you take the shirt off so I can look at your skin. Thank you. All right, so Mr. Johnson's skin looks like it's intact. No redness, no rash noted. Can you just turn around for me really quick, Mr. Johnson? All right, thank you. All right, so Ms. Johnson's skin looks good. I'm going to check his legs, skin, everything looks okay. There, thank you. So now, Mr. Johnson, I'm just going to listen to your abdomen and listen to your bowel sounds. All right, bowel sounds all for quadrant. When was your last bowel movement?
This morning.
Okay, awesome. Was nice and normal?
Yes, ma'am.
Anything? No diarrhea, nothing? Okay, thank you so much. So I'm going to palpate just your abdomen. Tell me if you feel any pain when I palpate you.
No pain.
Okay, no pain. Thank you. All right, let me just check here. I know you're male, but sometimes males need to be checked their breasts for any lumps or any abnormality there. Thank you so much, Mr. Johnson. All right, Mr. Johnson, so I'm going to go ahead and check the rest of your reflexes. Let me check your reflex. All right. Very good. Check this already. Okay, thank you. Mr. Johnson, you go ahead and sit up for me. Okay. You okay?
Yeah, good.
Thank you. All right. Reflex are nice and intact. So just sitting up, let me go ahead and look at your legs. If any edema or anything. All right, so I don't see any pressure ulcers or any edema on Mr. Johnson's leg. His toes is nice and intact. No bunions on either toe bilaterally. Okay, thank you. All right, so Mr. Johnson, I'm going to have you walk for me. I'm going to have you walk towards that curtain. Can you walk back for me? Thank you. All right, this time I'm going to have you walk on your tippy toes. Come back to me. All right, thank you. All right, you can have a seat. Do you have any question, Mr. Johnson, about anything?
Nope.
All right, so I think you're in pretty good health. Continue seeing the eye doctor. And also going to the dentist. That should be once a year. And I'm sure you're probably up to date with your tetanus shot. And so if there's no other questions, thank you for allowing me to assess you today. Have a good day, okay?